and I hope you'll work toward that goal. Thank you.
Thank you. Is there any other proponents? We'll move right over into opponents. And we'll give the opponents the 40 minutes we gave.
Mr. Chairman, members of the committee, Diane Sanshouse, District 95, Chairman of the Interim Committee on Children, Families, Health, and Human Services. You know, all of these bills have good things in it. I supported Senator Essman's bill in the Senate. I think there are excellent things in that bill. I think there are good things in Representative Noonan's amendments. There are good things in the Smith amendments as well. In the end, all of them are trying to accomplish the same things. We have got to regulate this industry. We've got to put some sideboards on where the problems are. And we've got to do what we think the public wanted, which is to make marijuana available for people for whom we thought this have a debilitating condition that this could provide for. All of these bills do that. They do it in slightly different ways. Addressing the issue of clarifying gray areas, I think all of them pretty much agree in ways you heard from many of the proponents around law enforcement, local government authority, hospitals. They're much more consistent across all those categories, across all of these bills, than you probably would know. And they haven't been contentious, so you usually don't hear much about them. Then clarifying and making that clear, bright line between legal and illegal activity. That is the hard one, because with $100 million or so in unregulated activity out there, you don't know where the line is between legal marijuana and illegal marijuana. And all three of these bills go quite a ways to trying to clarify that, but they do that in very different ways. Health and safety for the patients to get it, I'm going to say that I think the best of the bills in that way is Representative Smith's amendments. It really strengthens the doctor-patient relationship. This is about medicine. This is about a physician with his or her patient making a decision on whether that person has a condition they believe would be best served by this, period. We should not, as legislators, as much as we can, stay out of practicing medicine. The Smith bill is the strongest in that regard. The others both address it as well and are, in my view, perfectly acceptable. But the Smith bill is the strongest in that regard. It also strengthens the doctor-patient relationship in a number of other ways. In all the bills, we've clarified the role and responsibility of physicians under the Board of Medical Examiners. And we do that in different ways. There's a trigger in each of these. I think the 15 patient trigger of going to the Board of Medical Examiners for review is perfectly acceptable. You can make it higher or lower if you wish. We restrict, about the only people we restrict who can't have a medical marijuana card are people who are under the control of the Department of Corrections or all those related entities for a very practical reason. Those institutions are not legally able to have this product anywhere in their control, and the physicians can't manage it. And I know that means some people who could probably really use it aren't going to get it, but I don't think there is a way you can deal with that at this point. Patient privacy is protected in these. The person who is the provider of medical marijuana in Representative Smith's bill, and I believe in the others, their name goes to the local law enforcement entity so that there is access to that. And I think as the department addressed, that problem is basically already addressed. The major area where I see there's a difference is how does that patient who now has a card access medical marijuana? Is it in Representative or Senator Essman's bill through a regulated system where we regulate the growers, producers, and the couriers, which is modified in Representative Noonan's bill in some ways, but it's still having a medical marijuana industry that can regulate, has some transparency, but does exist and is regulated. That's good. A lot of states have that. That can work. That's fine. I think the real interesting part and strength in Representative Smith's bill, and it's also in Senator Essman's, is you clear out the old medical marijuana system. If we had regulated it from the beginning, it would be a different thing. Other states have done this different ways. There are states like Washington that do exactly what's in Representative Smith's bill. They don't allow marijuana to be sold or bought. They allow it to be legal, you can grow it, but it is not a product to be sold or bought, and there are no dispensaries. There are others that go the nonprofit model that's in Senator Essman's bill. That's not uncommon as well. Most of the states, if they have a dispensary growing system, have it regulated in some way that's very similar to both of these. They try to give oversight to some Department of State, who then is accountable for how that process happens. And then there's only a couple of places that it's whatever. But for the most part, they're all tightly regulated and moving toward being more tightly regulated. So you could pick the one you choose. Clearly, this is in your hands. I like Senator Essman's bill. I never even considered that it would be possible to sweep them away and do it as the Smith bill does, which I do fully support. And I believe that people can get it. Before President Obama's Attorney General Holter issued that statement, there were only a couple of thousand of people who had medical marijuana cards. And how did they get marijuana? For the most part, they got it by growing themselves, or they had one provider who grew it for a very small number of people. Very small number of people. People can learn how to make the tinctures and the butters. It's not that complicated. Yes, it can be a high science, but most people could learn to do it adequately. I think the provisions in the Smith bill go a long way to cleaning this out at this point, to going back to what the voters wanted, making sure that people can get the medical marijuana that they're entitled to. It strengthens that doctor-physician relationship, and I think it's a good bill and should look at it. Thank you.